Good evening, everyone. I am Colonel Rajesh Khanduja, nephrologist consultant at Tagore Hospital, Jalandhar. Just a few words. I am an FMC graduate and I did my post-graduation from Army Hospital, RNR, and then I did my nephrology from AIMS. I have served in the Army for 29 years, and as a second innings, I am right now in Tagore Hospital for the last 12 years. I am going to talk about fetal edema and chronic kidney disease, causes, symptoms, and treatment. So today when we discuss chronic kidney disease or CKD and its association to fetal edema along with its causes, symptoms, and treatment, I will first start my talk with trying to understand what is chronic kidney disease. The continuing and permanent degeneration of the kidneys is known as chronic kidney disease. The kidneys are a vital organ in the human body. They serve a variety of purposes, including maintenance of the body's mineral and electrolyte balance, maintaining the body's fluid status, excretion of water-soluble elements, maintaining the acid-base balance, and being responsible for creating hormones which are responsible for blood production and maintaining the vitamin D metabolism of the body. Now, it's quite apparent that if a kidney that has been damaged will lose this capacity to execute these functions. And however, that is why there are 5 stages of chronic kidney disease. In CKD stage 1, we have the kidney which is practically normal and more than 90% of the kidney is functioning properly. In stage 2, the kidney function is mildly decreased from 60 to 89% of normal. In stage 3, the kidney function is decreased further to about 30 to 59%, and in stage 4, the kidney function is severely decreased from about 15 to 29% of normal. When we come to stage 5 of chronic kidney disease, there is kidney failure to the extent that the kidney is working at less than 15% of the normal. This progressive loss of function implies loss of functioning nephrons over a period of time. And since the kidney has the capacity to compensate for the lost function, by hyperfunctioning of residual nephrons, signs and symptoms may not appear until significant permanent damage has already taken place. Coming to the symptoms of chronic kidney disease. Some of the commonly observed symptoms of CKD, depending on the severity, are swelling of the feet and ankles, which is called fetal edema. And that will be the main crux of my discussion for today and will form the mainstay of my discussion. Swelling or puffiness of the tissues just beneath the skin, which may occur around the eyes, the feet, the ankle. And this leads to skin that is stretched or shiny. The skin may retain a dimple or a pit once it is being pressed for several seconds. Other symptoms of edema will depend on the amount of fluid that is retained by the body, and this leads to swelling of the body. And this swelling will occur according to where this fluid accumulation has taken place. So, we will have ascites if the fluid accumulates in the abdomen. We can have a pleural effusion if the fluid accumulates around the lungs, or we can have a pericardial effusion if the fluid accumulates around the heart. These signs show the presence of edema are the swelling or puffiness in certain areas or all over the body, as I've just discussed. Trouble while walking if edema in the legs or feet is present. Increased abdominal size if ascites is present. Coughing at rest or on lying down, or having trouble breathing on exertion, once due to edema in the lungs, which is also known as pulmonary edema. And this fluid may also be present around the lungs, and so then we can have the pleural effusion. So when this happens, then the symptoms are practically the same. So as we have discussed earlier, this edema that we are going to talk about is part of the chronic kidney disease. And there may be associated symptoms of chronic kidney disease along with this, such as nausea and vomiting, which will occur in moderately advanced chronic kidney disease. Lack of appetite is an important early symptom of moderately advanced CKD. Sleep problems may occur. though this is later in the progression of disease and once the development of uremia takes place. Urination problems may be present. Now we can have a problem of polyuria when there is increased frequency of urination, or there is a problem of oliguria when there is decreased quantity of urine that is being produced. And in chronic kidney disease, both these conditions are possible depending on the etiology of the chronic kidney disease. Diminished mental sharpness may be present, muscular cramps may be present, high blood pressure is a very important and common association of chronic kidney disease associated with progressive declining renal failure. And this especially from stage 3 onwards, and this will require more and more antihypertensives to be added as the chronic kidney function deteriorates. What this implies is that as we move from stage 3 to stage 5, the blood pressure gets more and more difficult to manage and requires more and more antihypertensives for control. Shortness of breath may also be due to fluid overloading, which can be pleural effusion, pulmonary edema, or due to metabolic acidosis, as I've already discussed earlier. Now, let us try to analyze how this pedal edema is linked to chronic kidney disease and how does it form about. Edema forms in patients with chronic kidney disease for two reasons. Either there is a loss of proteinuria in the urine due to glomerular dysfunction, or there is impaired kidney function with consequent inability to manage the fluids. Now, nephrotic syndrome is defined as a significant loss of protein in the urine along with development of edema, because there is a decrease in the protein called albumin in the blood, which results in the reduction of the oncotic pressure in the blood, and this leads to leakage of fluids from the capillaries into the interstitial spaces. Now, as a result of this, the body and the kidneys both sense a decrease in blood volume, intravascular blood volume, and they try to attempt to retain salt and water in the vascular system. So, coming to the next aspect, and what are the causes of this edema in general, and out of which one of them is chronic kidney disease. Being overweight, we have seen. Standing or sitting for long periods, we have seen that this leads to pedal edema. But this is because in this situation there is impaired return of blood to the heart, and thus this edema occurs, so it is reversible. Now, what we will be surprised to know is the commonest cause of edema is pregnancy. So, every lady during her gestation at some stage or the other experiences some degree of pedal edema. But I am not going to touch on this today. I am just going to mention it in passing. Other causes of edema can be caused by a variety of diseases and conditions which are called pathological conditions. A blood clot in the lung, or DVT, deep vein thrombosis. Injury or infection can of course cause edema, as we have seen so frequently. Venous insufficiency, when the leg veins or blood vessels are weakened or damaged or have inefficient valves, leading to chronic venous insufficiency. And preeclampsia. Apart from pregnancy, which will have a normal variation of edema which can come and go, this during pregnancy you may have a preeclampsia. Now, this will cause elevated blood pressure, which can lead to impaired circulation, and thus it can lead to swelling of the legs, face, and hands. Cirrhosis, that's very important condition that in the liver, once cirrhosis occurs, there is severe scarring of the liver, and this may be because of alcohol or viral infections, and this leads to ascites and edema. Congestive heart failure, a very important condition that we see in our clinical practice as a cause of edema. When one or both of the ventricles of the heart lose their capacity to effectively pump blood. So, if we have a situation of right heart failure, then the legs, the blood, and ankles and feet, the damming of the blood takes place because it is not able to return to the heart, and this leads to edema. Kidney disease, edema can occur when there is too much fluid, salt and water in the bloodstream, as I have just discussed earlier. And edema caused by renal disease mainly affects the legs or the periorbital thing. Other causes I mentioned in the passing is inadequate lymphatic system when affected by cancer or lymph nodes. Then the drainage is affected and swelling may take place. Long-term protein deficiency, if there is deficient in protein for a long time, it can lead to edema. So now we have touched upon the causes of edema and the etiology. So how to manage this edema? Quite clearly, Treatment of edema includes addressing the underlying cause. That is the most important thing that we must understand. Lowering salt intake, as I've explained, increased salt intake in the body leads to increased edema. So lowering salt intake will have a beneficial effect. Fluid restriction. So that is quite clear. Edema is because of excess fluid. So fluid restriction will have a salutary effect on the overall situation. And using a diuretic to eliminate the excess fluid from the body. It may also be beneficial to use compression stockings, and this is a supportive method, so that elevation of the legs, compression stockings will help all the measures that we have taken earlier. A few words about these methods. Reducing the salt intake. Salt consumption can be restricted by restricting table salt and avoiding processed foods and fast foods in our diet, which will help in minimizing the edema and thus restricting the salt intake, which we have already proven that it is the etiological reason for induction of edema. Use of diuretics, as we all know, we have heard there are so many diuretics in use and they are used so frequently. I will not touch more. Only thing is that when we use the diuretics cause kidney to excrete water and salt, and this leads to removal of water and thus the edema is ameliorated. Compression of stockings, as we can understand, it can be used to prevent edema, it can be used to treat leg edema. And effective compression stocking exert the most pressure at the ankle and decreases the pressure as we go up the leg. Body positioning, as we have discussed earlier, elevating the legs above the heart will return the blood to the heart and thus improve the edema. So, to close the thing, it is not always possible to prevent CKD. Controlling disease like high blood pressure and diabetes is important. And if you are at risk, you should try to reduce the evolution of CKD. And once edema occurs, limiting salt intake, choosing food with low potassium, and having physical activity can help in reducing the pilled edema caused by chronic kidney disease. With this, I end my talk today on pilled edema and CKD, the causes, the symptoms, and the treatment. I hope I have been able to make an impression, and I look forward to your questions if at all. Thank you for a patient hearing.